Antiseptic smells like lies in a place that's supposed to save people. The truth, Lena Varro had learned, smelled like engine exhaust, wet concrete, and the particular sweetness of blood that's been sitting too long in the sun. She knew both smells well. Here in the long, buzzing corridors of Covenant Regional Medical Center, only one of them followed her around. She'd been assigned to the surgical prep floor for the week. Third float assignment in 3 weeks. Before that, the cardiac step-down unit. Before that, the cardiac overflow ward during a respiratory virus surge. She didn't complain. Floating meant nobody owned her. Nobody invited her to birthday celebrations in the break room. Nobody asked her to cover anyone's charting because they built up enough social debt to make the request stick. She showed up. She did the work. She left. It was exactly the arrangement she needed. The charge nurse on 7 West was a man named Thibodeau, and Thibodeau had opinions. He wore his credentials on a lanyard so long it nearly reached his belt, and he moved through the unit with the particular energy of someone who had never once in his professional life been proven wrong and intended to keep it that way. "Barrow," he said, not looking up from the scheduling board when she arrived at 6:30. He always used last names. It was a power move dressed up as efficiency. "You're on rooms 4 through 9 today. Routine pre-ops, nothing exciting. Do the checklists, confirm consents. Don't touch anything that requires a physician order, and stay out of the way of my core staff during the Hendricks bypass at noon." "Understood," Lena said. Her voice came out the same way it always did now. Flat, smooth. The verbal equivalent of still water. She took the tablet he slid across the desk without comment, clipped her badge to her scrub top, and walked toward the supply room to start her day. The rooms were straightforward. A knee replacement in 4, a laparoscopic cholecystectomy in 5, a 63-year-old man in 6 with atrial fibrillation scheduled for a cardioversion, who kept trying to negotiate with her about whether he really needed to fast. She checked vitals, confirmed allergies, explained procedures in language that was clear without being condescending, and made sure every patient felt like a person and not a line item on a surgical schedule. In room 8, she found a woman named Mrs. Fitch, 71, admitted overnight for a bowel resection that had been bumped twice already. Mrs. Fitch was sitting up in bed with her hands folded in her lap and the particular dignity of someone who had decided, somewhere around her 3rd decade of being alive, that she was not going to let the world rattle her. "You're new," Mrs. Fitch said. "I'm afloat," Lena told her. "I go where I'm needed." "That's a kind way to put it." Mrs. Fitch tilted her head. "What did you do before this?" Lena kept her eyes on the blood pressure cuff she was attaching to the woman's arm. "This." Mrs. Fitch was quiet for a moment. "You have the hands of someone who's done something harder." Lena didn't answer. She noted the blood pressure reading on the tablet. 128/74. Good. And removed the cuff with the same care she used for everything. "Surgery should be around 2, she said. "I'll check back before they take you down." She left before the woman could ask anything else. The morning passed in the rhythm she'd built for herself. Steady, manageable. She had learned in the years since she'd come home that manageability was not the same as happiness, but it was something to stand on while you figured out what came next, or while you decided, quietly and without drama, that there might not be a next. That maybe the shallow end of the pool was enough. That some people were built for depth, and others learned, eventually, to be afraid of it. She was in room 9, updating a post-anesthesia checklist for a patient who had been moved to recovery when Thibodeau's voice came over the intercom. It had lost its usual crisp authority. There was something underneath that she recognized immediately, the way you recognize the sound of a car skidding before you see the crash. All available staff to the emergency bay entrance. All available staff. This is not a drill. Lena set down the tablet. She didn't run. She walked quickly with purpose, because running in a hospital tells everyone within eyesight that control has already been lost. She heard it before she reached the stairwell door. Not the sound of sirens, not the squeal of an ambulance. The sound was lower, more deliberate. A rhythmic, concussive thudding that she felt in the back of her molars before she processed it through her ears. She stopped walking. Her hand rested on the stairwell door handle, and she did not push it open. Rotary wing aircraft, heavy frame. The kind that doesn't announce itself so much as it announces that everything else has to stop. She knew that sound the way she knew her own pulse. She pushed through the door. The emergency bay on the ground floor was a controlled chaos that was rapidly becoming the other kind. 2 security guards stood near the ambulance entrance, looking uncertain in the way that people look when something has arrived that is entirely outside the parameters of their training. Thibodeaux was already there, his lanyard swinging as he turned to face the entrance doors, and beside him stood Dr. Anand, the attending on call, a sharp-minded cardiologist who was visibly recalibrating her entire understanding of what this Tuesday morning was supposed to look like. They called ahead, a security guard was saying, sort of. They identified themselves as a government medical transport and said they needed immediate surgical capability. "We're not a trauma center," Thibodeaux said. I told them that. And they said they were landing anyway. The doors blew open. Not from a mechanism, from weight. 2 men in tactical gear each put a shoulder into the push bar simultaneously, and the doors swung back hard enough to crack against the exterior wall. Behind them came 4 more, and between them, carried on a rigid field stretcher, was a man who should not have been alive. Lena pressed herself back against the wall near the nurse's station. Her instinct was not to run. Her instinct was to assess. She couldn't help it. 8 years of training and 3 years of things she didn't talk about had made it involuntary. The man on the stretcher, late 30s, male, substantial build, had a pressure dressing on his right shoulder that was saturated through. The dressing had been applied with knowledge. It wasn't haphazard. Whoever had done it understood wound packing, but the packing was old, and the blood loss had been ongoing, and his color was wrong. That gray-yellow pallor, like clay left too long in the sun, that meant his body was pulling everything it had toward the center and abandoning the edges. His face was slack. His breathing was shallow and fast. "We need a surgeon," the lead operator said. He was taller than the doorframe, comfortably accommodated, broad through the chest, with a jaw that looked like it had been constructed with structural intent. His tactical vest was covered in dust that was the wrong color for anything domestic. "Tell me you have a surgeon." "Our surgical team is in the middle of a procedure," Dr. Anand said, stepping forward with a professionalism Lena genuinely admired. "I'm the attending on call. Tell me what happened." "GSW, right shoulder, through and through, nicked the subclavian on exit. We got bleeding controlled 15 minutes out, but he's been hypotensive since the incident. He's going to blow the tamponade." Anand absorbed this without blinking. "When?" 20 minutes, maybe less." "Blood type?" "O negative." Anand turned to Thibodeaux. "Get me O negative from the bank, start a massive transfusion protocol, and get OR2 prepped. Page Dr. Kellerman." "Kellerman is mid-bypass," Thibodeaux said. "Then page whoever's next on the trauma consult list. Our trauma consult is 30 minutes out. He covers 3 hospitals." The pause that followed was only 2 seconds long. It felt considerably longer. Lena was still against the wall. She had counted the blood on the pressure dressing. She had noted the deviation in the man's trachea. Subtle, not dramatic yet, but real. She had looked at the skin around his clavicle and seen the way it was beginning to tighten. She had done all of this without deciding to. Her hands, which she had shoved into the pockets of her scrub top, were very still. She did not want to do this. She was so clear on that point, inside herself, that it almost felt like an argument she was winning. She did not want to step out of the wall. She did not want to be seen. She had spent 3 years building a life that did not require her to be seen, that allowed her to perform acts of quiet competence and then withdraw, unnamed and unremarked upon, back into the ordinary. The man on the stretcher made a sound. It was not loud. It was the kind of sound a person makes when their body is beginning, very seriously, to consider giving up. Lena's hands came out of her pockets. She moved away from the wall. "The subclavian bleed is reopening," she said. Her voice was not flat anymore. It had a different quality, like a signal that had found its frequency. Everyone turned. Thibodeau, Dr. Anand, the operators still holding the stretcher. They looked at her the way people look at someone who has appeared in a place they weren't expecting, said something they weren't expecting, in a tone they weren't expecting. The lead operator, she'd catch his name later, it was Sergeant Casson, stitched on his vest just below the blood, looked at her for approximately 1 second. His eyes did the calculation that experienced people do when they encounter other experienced people, a kind of recognition that has nothing to do with having met before. "You have surgical access?" he said. "I need a vascular tray, a fluoroscopy unit if you have one available, and O-negative running wide open in 2 large bore IVs." She was already moving toward the stretcher. "And I need the room cleared to essential personnel. Right now." "You are a float nurse," Thibodeau said. The words were very precise. They landed the way he intended, which was to remind everyone in earshot exactly what the hierarchy was and exactly where she fell within it. Lena looked at him. She had looked at people under worse circumstances and with less certainty about what came next, and she did not look away. "I'm a float nurse who completed 2 combat deployments as a Special Operations Combat Medic, spent 14 months running a forward surgical team in a classified operational environment, and personally managed 11 subclavian vascular injuries, 4 of which were worse than this one." She pulled a pair of gloves from the box mounted on the wall beside her and snapped them on. "You can contact the medical director and establish my credentialing after the patient is stable. Right now, if you want this man to be alive in 20 minutes, you need to get out of my way and get me that vascular tray." Nobody moved for 1 full second. Then Casson said quietly to the other operators, "You heard her. Everybody back." And they moved. Thibodeau did not move. "This is a massive liability," he started. "Thibodeau." Dr. Anand cut him off with the clean authority of someone who had just made a decision and would not be revisiting it. "Get the vascular tray. Get the blood running. I'll stand with her and I'll co-sign every order. Go." He went. Lena was already at the stretcher. She peeled back the saturated pressure dressing with both hands and did not react to what she found beneath it, because reacting was a luxury that belonged to people who weren't currently the most important person in a room. The exit wound was inferior to the clavicle, medial to the shoulder joint. The trajectory was consistent with what Casson had described. The subclavian had been nicked on exit, not fully transected, which was the only reason this man was still breathing, and the improvised packing had held for however long they'd been in transit, but the tissue was giving way. "What's his name?" she asked. Casson, standing at the perimeter she'd established, said, "Graydon." "Graydon." She said it at a normal volume, directed toward the man on the stretcher. "I'm going to take care of you. Stay with me." His eyelids flickered. That was enough. A nurse she didn't know. One of Thibodeau's core staff, a younger woman named Solis, who had apparently decided in the absence of explicit orders to just be useful, appeared at Lena's left shoulder with a vascular tray still in its sterile wrap. "Thank you," Lena said. "Open it for me and then get me a 5-0 proline if we have it. If not, 4-0. "We have it," Solis said. "Good. Stay close. I'm gonna need you." Dr. Anand materialized on the other side of the stretcher, snapping on her own gloves. She didn't speak. She watched Lena's hands with the focused attention of someone filing away everything she was seeing for later. That was fine. Lena had been watched before. The O-negative blood arrived. Thibodeau had moved faster than she'd expected him to. She'd give him that, and Solis hung the bags while Lena worked. 2 large-bore peripheral IVs, both confirmed patent, both running wide open. Graydon's pressure was 74 systolic when they got a reading. It needed to be higher. "Pressure's low," Solis reported, watching the monitor. "It'll come up when the bleeding stops," Lena said. "Not before. Keep the blood moving." She worked fast, not panicked. Fast had nothing to do with panic. She'd learned that in a river valley she never named to anyone, in the dark, with nothing but a headlamp and whatever she'd been able to pull from a trauma kit that was 2 items short of complete. Fast was just the appropriate speed for the situation. It was a calibration. The subclavian repair was not simple. It was not something that appeared in the standard skill set of a floor nurse or even most ER nurses. It required knowing the anatomy the way you know a room you've lived in, knowing which errors are recoverable and which are not, knowing how to maintain control of a vessel that does not want to be controlled while a man's blood pressure hovers at the edge of incompatibility with life. She had done this before. She focused. The room contracted. The monitors beeped. She heard them and did not hear them. She heard Anand breathing steadily on the other side of the stretcher, and that was useful. A steady colleague was a useful thing. She heard Casson behind her, very still, in the way that trained people are still when they're managing their own response to a situation they can't control. Proximal control, she said more to herself than anyone. Her hands moved. There, got it. The bleeding that had been welling in the wound cavity slowed. Stopped. The room was very quiet. "Pressure's coming up," Solis said. Her voice had a quality in it that Lena recognized, the specific release that comes when a situation has passed the worst point. 82. 86. Good. Lena held position, watching the wound. Hold. 90 seconds. The bleeding did not resume. She began the repair. She had explained to Solis what she needed before she needed it, and Solis, who turned out to be quick and calm and an excellent instinctive scrub assistant, handed her each instrument a moment before the request. This was the part that required patience, not speed. Speed had gotten them here. Now the work required the kind of careful deliberation that was its own form of control. Dr. Anand watched every suture. When Lena finally stepped back from the stretcher, her gloves were red to the mid-forearm and her lower back ached from the angle she'd held for the last 40 minutes. Graydon's pressure was 103 systolic and climbing. The wound was closed, the repair would need imaging and a vascular surgeon's follow-up, and he was going to need a proper OR as soon as they could arrange transfer. But he was alive and stable, and his color, even now, was starting to return at the edges. She stripped the gloves into the biohazard bin and stood for a moment looking at the monitor. "Pressure's 112, Solis said softly. She sounded like she wasn't sure she was allowed to feel what she was feeling. "He'll need transfer to a level 1 as soon as he's stable enough," Lena said. Her voice had returned to its normal register, flat, quiet. "Dr. Anand, I'll defer to you on timing and destination. The repair is provisional. A vascular surgeon needs to take a proper look at it within the next 6 hours." Anand was still watching her. She had not stopped watching her since Lena had pulled on her gloves. "Bara," she said. "Yes." "That was exceptional work." Lena nodded once. It was not false modesty that kept her from saying more. It was that she genuinely had nothing to add to a statement of fact. She turned and walked toward the restrooms at the end of the hall, because she needed to wash her hands, and she needed a moment that was not this room and this light and these people looking at her. The restroom was single occupancy. She locked the door, turned the faucet on as hot as it would go, and stood over the sink watching the water run pink and then clear. Her reflection in the mirror was someone she recognized but didn't spend much time with. Someone who looked older than she remembered and steadier than she felt. 3 years ago, she had driven away from a military installation with a duffel bag and a folder of discharge paperwork and the sincere, bone-deep intention of never being responsible for a stranger's life again. She had meant it. She had meant it the way you mean things when you're exhausted down to the cellular level and you've spent a long time being the person in the room who everyone depends on, and you just want, more than anything else, to be ordinary. She had almost managed it. She dried her hands on the paper towel and held them up in the fluorescent light. Steady. The thing about muscle memory, she thought, is that it doesn't ask permission. The knock on the door was quiet but deliberate. She already knew who it was. She unlocked it and pulled it open. Casson was standing in the hallway. He'd removed the outer layer of his tactical vest, which made him look slightly less like a threat assessment and slightly more like a person. His face was exhausted in the specific way of people who have been awake and alert and responsible for other people's lives for a continuous stretch of time that they've stopped counting. "Hayes sends his regards," he said. Lena stared at him. "Staff Sergeant Hayes," Casson said. "He said if you were working a hospital anywhere in the Mid-Atlantic region, you'd be the only nurse anyone would send." He was right. "Hayes retired," Lena said. "He did. He's living in Raleigh. His knee's giving him trouble." A pause. "He spoke highly of you." "Hayes speaks highly of anyone who doesn't make things worse." Something in Casson's face shifted. It wasn't quite a smile, it was adjacent to one. "Graydon's going to make it," he said. "He needs a vascular surgeon. He'll get one. We've arranged transfer to Johns Hopkins, wheels up in 40 minutes. Lena leaned against the doorframe. Her back still ached, and the fluorescent lights in the hallway were the particular shade of white that made everything look slightly unwell. She was aware, distantly, that back on the 7th floor, Thibodeau was probably on the phone with the medical director, and there would be a conversation at some point that she would have to navigate, and that navigating it would require a version of herself that she was not currently in the mood to be. "I need to get back to my floor," she said. "I know." Casson reached into a pocket on his vest and produced a folded piece of paper. He held it out. "Hayes wrote that down. In case." She took it. She didn't unfold it. "You don't have to go back to floating," Casson said. It was not a pitch. It was not a recruitment speech. It was a simple declarative sentence offered without pressure, which was the only way she would have been able to hear it. "I know," Lena said. "But you're wasting something." "I'm preserving something." He looked at her for a long moment. He had the eyes of someone who understood the difference between those two things and had enough sense not to say which one he believed was actually happening. "Thank you," he said, "for Graydon, for all of it." She nodded. He turned and walked back toward the emergency bay. She listened to his footsteps until they faded, and then she looked down at the folded piece of paper in her hand. She put it in her pocket. She took the stairs back to 7 West. Thibodeau was standing at the scheduling board when she walked through the doors, and the look he gave her was the look of a man who had been thoroughly reconfigured by the last 90 minutes and was still sorting through the implications. He opened his mouth. He closed it. Lena picked up the tablet she left on the nurse's station counter. "I still have rooms 6 through 9, she said. "Mrs. Fitch in room 8 is scheduled for 2 o'clock. She was bumped twice already. I'd like to make sure it holds." "It'll hold," Thibodeau said. His voice was different. Not humble exactly. Something more complicated than humble. "Good." She pulled up the checklist on the tablet. "I'm going to go check on her." She walked down the hallway, past the rooms she'd started in that morning, past the window at the end of the corridor where the late morning light was coming through at an angle that turned the floor a pale, temporary gold. Mrs. Fitch was sitting the same way she'd been sitting earlier, hands folded, back straight, watching the door as if she'd known someone was coming. "You were a while," she said. "Something came up," Lena told her. The older woman looked at her for a moment with the particular attention of someone who has lived long enough to read what people don't say. "Surgery's still at 2?" she asked. 2 o'clock, Lena said. "It'll hold." She began her pre-op check. Blood pressure, consent review, IV access, allergy confirmation. The ordinary architecture of care. The thing she had built her life around in these 3 years. The small, repeatable acts of competence that kept other people safe and kept her somewhere between the person she used to be and the person she was still deciding to become. In her pocket, the folded piece of paper sat quiet and unread. She wasn't ready to read it. She didn't know if she ever would be. But she had not thrown it away. I keep thinking about the moment Lena didn't move. She was pressed against the wall, watching a man bleed out on a stretcher, and she made a choice, or something that looked like a choice. She told herself she was done with this, that she'd paid enough, that a person has the right to decide how much of themselves they give to the world before the world takes everything that's left. And then Graydon made that sound. I've been around enough people who've carried weight like hers to know that what happened next wasn't heroism in the storybook sense. It wasn't courage rising up like a wave. It was something quieter and harder than that. It was integrity finally outrunning exhaustion. She moved because the alternative, standing still while someone died, wasn't something her character would allow, no matter how badly the rest of her wanted out. That's the thing about who we actually are. It shows up when we stop performing and start reacting. Thibodeau could announce his credentials on a lanyard. Lena wore hers in the steadiness of her hands. What strikes me most about her story is that she didn't fail because she hid. She survived because she hid. There's a difference, and it matters. She needed those 3 years of emptying bedpans and floating between units like a ghost. She needed to be nobody for a while. The quiet wasn't weakness. It was the only way she could keep herself intact long enough to be useful again when it counted. But here's what I think she understood, standing at that sink with the water running clear. That knowledge doesn't spoil. Everything she learned in those forward surgical deployments, every subclavian repair, every split-second call made in the dark with inadequate equipment and no margin for error, none of it had gone anywhere. She'd tried to bury it, and it just waited. Patient. Indifferent to her plans. That's the part that stays with me. You can walk away from what you know how to do. You cannot walk away from what you are. Lena is someone who was built through years of hard and deliberate training and then harder real-world pressure into a person with both the skill to save a life and the judgment to know when to act. That's not a personality trait. That's a result. It came from somewhere. It came from choices she made long before that emergency bay, from the discipline of learning difficult things thoroughly, and from caring, actually caring, about the strangers who ended up on her table. I don't think the folded piece of paper in her pocket is going to stay folded forever. I don't know what she decides. But I think she already knows that going back to being invisible was always a temporary arrangement. You can only hold something that capable in reserve for so long before it insists on being used. Some people spend their whole lives looking for what they're for. Lena already knows. The hard part isn't finding it. The hard part is deciding, one more time, to carry it.